and welcome to yogahub podcast, where we bring you conversations of some of the world's leading yoga and movement educators. In this episode, I'm talking to Tiffany Cruikshank. Tiffany is one of modern yoga's most influential teachers. She has been teaching for 28 years, and inspired by her background in acupuncture, traditional Chinese medicine, sports science, and orthopedics, she founded Yoga Medicine, which looks to blend Eastern and Western approaches to explore yoga as a form of therapy. We're very excited to be hosting Tiffany at our Camden Street studio in early September for her Stress and Resiliency retreat, which will focus on helping us build the tools to develop resiliency and counterbalance the effects of stress. You can find out more about this at yogahub.ie/workshops. Thank you very much for tuning in. I hope you enjoy my chat with Tiffany. Okay, cool. So, Tiffany, thank you very much for taking the time out of your day to have this conversation. It's a real honor to be talking to you. I've been a big fan of your work for a long time. And as I think I said to you when we were emailing about setting this up, probably like 8 years ago now at this stage, I did an online course of yours on myofascial release that I still use the techniques that you covered in that course to this day. So yeah, it's a real honor to get the chance to talk to you and pick your brain about a couple of things. First and foremost, how are you doing today?
Good. Thanks for having me. I love hearing that. I feel like the MFR stuff never gets old. I still use many of those techniques that I used when I started it 20 some years ago. So I love hearing that. Yeah. And thanks for having me.
Not a problem at all. So to begin, I thought it could be nice for anyone who's maybe not super familiar with your work at this moment in time, if you want to take a few moments to, in as much or as little detail, give us a little bit of your background, maybe who you were before you found yoga and how your work has progressed to get you to this point where you are now.
Okay, I'll give you the short version, but I did start practicing yoga when I was in my early teens, and I was a bit of a troublemaker, and my parents sent me off on a wilderness program. And when I came back, well, first off, just being in the wilderness and learning to survive was really empowering for me as a young teenager at the time who felt very lost and like most teenagers. And that was really empowering. I also met an herbalist out on that. One of my guides was an herbalist, and he would take me out on plant walks. I think he was just excited because I was the only person who was interested. And it really turned me on to holistic medicine. And when I came back, this was in the 90s, the early 90s, and there wasn't any internet yet. So I just remember seeing a little sign that said yoga and a phone number, and I kept passing it. It was somewhere probably near our house. And finally I remembered the phone number, and my mom drove me, and it was in a chiropractor's office. And there's just something about it I fell in love with. And obviously that relationship has evolved a lot over the past 28 years or so that I've been practicing yoga. I've trained yoga teachers for about 22 of those years, just because there was such a need for yoga teacher trainings at the time. There weren't very many. And so in Portland, I started training teachers out of my little apartment. I would go take my own teacher trainings and then come back and teach them everything I'd learned. And eventually it turned into a full 200-hour. And soon after, I think it was in 2008 or 2009, we had a full 500-hour, and that kept expanding. Also, when I went to college, I apprenticed with an acupuncturist who was a Zen monk and became really intrigued with Chinese medicine. And I was looking at going to some form of holistic medicine because that herbalist that used to take me out on plant walks when I was a teenager really turned me on to all things holistic, being able to heal ourselves with our environment around us. And so when I was in college, I was looking at all of these different programs. Ayurveda was one I looked at, naturopathic medicine, Western medicine even. But I really fell in love with Chinese medicine when I apprenticed with him in college, and then decided to go into Chinese medicine school. So I did my 4 years of undergrad and then 4 years of Chinese medicine school, and then came out and specialized in sports medicine and orthopedics. And I started seeing patients, and right away I found out that I noticed that my patients, I had a lot of patients who were also yoga students of mine. And I noticed that they got better a lot quicker than my patients who didn't do yoga. So I quickly started giving my other patients what I called yoga prescriptions, which was usually just one or two really simple things that they could do at home, sometimes just breathing, sometimes asanas. And I found that it was really helpful for enhancing my outcomes. I never wanted to be the thing that they were reliant on. I wanted to empower my patients. It's always been really important to me to empower them with tools to be able to optimize their own health and not be dependent on me. Of course, acupuncture has its own place as well that can't be totally replaced. But this was also early on when I started seeing patients, when I started using myofascial release, and found it to be a really potent tool to use with my patients so that they could also take home with them and continue our treatments between their visits too. So I really enjoyed using both of those. Eventually, I went on to work at the Nike World headquarters, and I had a bunch of practice in sports medicine, orthopedics, of course, which was my specialty, but also started getting a lot of patients coming in for fertility and female health concerns. And so I took on a secondary specialty in female health and fertility, and had a lot of fun working with females there. And eventually, all of my teacher trainings turned into what's now known as yoga medicine, which really was just my way of bridging the gap between the medical industries, the doctors, the research, the hospitals, the medical systems, and the yoga teachers. Ever since I first started practicing, I felt like the people that I networked with, the other healthcare providers, really wanted to be able to utilize yoga. They saw the effects in the people that I referred to them, maybe who were yoga practitioners, or maybe in their own experience working or practicing with me. But as anyone who's done yoga before knows, it's probably kind of negligent to refer someone to yoga, since they could end up chanting or jumping or contorting or doing a broad variety of things, any of which could be really helpful for some people and not so much for others. And so for me, creating yoga medicine was a way of really decoding that by teaching our teachers to understand both the Eastern and Western concepts of the body, but then also not only to be able to work more individually with their students, but to be able to work with the healthcare providers, not replace their healthcare, but to work with them and be an important adjunct that is so helpful and so important, I believe, in our healthcare systems. And so we just created a really transparent platform where people can see what our teachers have trained in. So if they have a patient with shoulder injury, they can find someone in their area who's done our shoulder module and whatnot. So yeah, that's the short version, I guess.
An interesting background. Also, the wilderness retreat. I'm not sure if you called it a retreat. Sorry, but the wilderness camp that you were sent to in your youth sounds interesting. Like a bit of a rite of passage. What exactly did it entail?
I don't know that it was a retreat. It was actually for troubled teens. So most of the people, I think, didn't really want to be there, which was why I think the herbalist was really excited that I was interested in his plant walks. But yeah, it was a really interesting program because you finished when they deemed you were ready, which for most people, I think was a minimum of like 2 months. I think I was out there for 3 months. We had limited food. So we had like, I think 1 bag of rice, 1 bag of lentils, a bag of flour, and an apple, and maybe a couple other things each week, and some Tang. I don't know if you guys have that there. It's like a sugary powdered beverage. Anyways, so we had to forage on the plants and hike about anywhere from like 8 to 12 miles a day, and set up camp. We had like a blanket and limited things to make our own shelter. So we had to really learn how to survive. And I became really interested in primitive living for a long time after that. For several years after that, it was really interesting to me to be able to make all these things yourself and do it all yourself. My favorite thing was I was always the one who wanted to make fire, make the fire from scratch again. No tools, no knives, no lighters, just making it ourselves. So that was, yeah, really rewarding.
It's interesting because it obviously sounds, I guess, like a correctional program of sort, if that's the right word. But it does sound like something that people would actually sign up to as a retreat now. I think these days there's a lot of interest in that rewilding, returning to a more maybe intimate way of living on the land. So yeah, kind of ahead of your time, I guess, in some senses. When you were telling us a little bit about your background, yeah, I think this...
I loved it. I mean, I love that people are interested now.
Yes. But yeah, in terms of your background and this kind of idea of bridging East and West and this idea of yoga as medicine, which I I think is super interesting, and as yoga, I guess, gained prominence in India in sort of like mid 20th century, I think there was that approach of yoga as therapy, yoga as medicine. And I guess with your understanding of things now, what is it about the practice of yoga that you think is so therapeutic or so medicinal?
Ooh, that's a great question. I feel like we could philosophize on that for a long time. I think for me, what's really interesting therapeutically about the practice is that it can look at so many different layers, and whether that's the physical layer and my orthopedic brain of looking at different ways of approaching the body. And I think from more of a sports medicine standpoint too, we tend to look at strength and training in a very different context. And I think yoga just really nicely covers a lot of the bases that aren't covered, like mobility and stability and recovery. I think a big part of the benefits that we see in the limited research that's available on yoga, the limited good research that's available on yoga, I think a lot of it really points to the aspect or the benefits coming from the nervous system. I think the nervous system is a big part of that, especially in our modern world, which, maybe wasn't as much of an issue when these practices were developed, but is definitely such a big part, I think, of what's happening in a lot of it. But I think another part of it is looking at the mindset, looking at the mental health lens, looking at the connective tissue. And so what I love to do with yoga medicine is really pulling in a lot of the new research and these kind of new modalities that also continue to modernize our practice, as well as pay homage to the the traditional practices that we know have stood the test of time, and then also taking an analytical lens to those as well, to be able to understand, now we have more research on breathing practices, which is really nice too. So we can kind of understand a little bit more about some of those traditional practices and better differentiate how and when those might be most useful for the person that we're working with. But yeah, I would just say that really honoring the three-dimensionality of the person. And I think within our healthcare systems too, one of the benefits of yoga is that a yoga teacher often gets to spend more time with them than any of their other healthcare providers. And so we really get to understand them and fill in the gaps between this static, limited diagnosis that they've been giving and the individuality of that diagnosis that is really unique to them. And so, 10 people with headaches will present really differently and probably need very different things. And so a yoga teacher can really fill that individuation of allowing it to be something that meets their own needs. And we just don't have that individuality in Western medicine, unfortunately. In some holistic medicine, of course, we do, like Chinese medicine and Ayurveda, a little bit in naturopathic, but less so in Western medicine. So I just think it really helps to personalize the medicine and allow us to really be on a journey with them. And I think one of the things that's really beautiful about yoga therapeutics is we welcome the patient or the student into that process with us. Yoga is really about taking ownership and empowering people to not only feel and discern what's happening in their body and this healthcare system within their body, but also to be able to navigate the healthcare systems too and what's helping. And I always say, I think just establishing better body awareness is that foundational component of really all of our healthcare systems. And if nothing more, even if yoga just did that, it would be such a helpful adjunct to all of our healthcare systems, that people can better understand what's helping, what's not, what's going on, and give better information to their doctors as well. So that was a long answer, but there's a lot.
It was a great answer though. Yeah, I've been studying a little bit myself under a guy called Dr. Peter Litchfield. I'm not sure if you ever come across him before. He's a respiratory scientist, I guess. But anyways, in the work he does, he doesn't directly teach yoga, but his stuff is very much yoga adjacent, let's say. But he talks a lot about the importance of becoming an active participant in your experience. So learning tools where you don't feel so overwhelmed by what's going on, but you actually understand your role in being able to manage, counteract, and even then potentially heal some of the things that you are experiencing in terms of health. And we're very lucky to have you over to our studios here in Dublin soon in September. And what you're hosting for us is a retreat focused around resilience and stress. So what I think would be great is if you could maybe in like layman's terms define those two terms for us, resiliency and stress, and maybe speak a little bit to the benefits of learning how to, I guess, cultivate a little bit more resiliency and potentially counteract a little the effects of stress.
Yeah, I think it's a really great question. And depending on where you look up resilience, you'll find different definitions. But really, I think for me, our resilience is our ability to bounce back, our ability to recover from stress, which is, really the reality of our lives. There's no way around stress. And I think one of the things that yoga does is training the nervous system to be able to bounce back and forth between that stress resilience mode or that sympathetic mode where we are working through a more stressful period, but also to be able to downregulate into that restorative mode, our parasympathetic mode. But I think also changing the viewpoint, changing the lens through which we see the world is such an important part of that resilience. Looking at stress as a positive thing because these stressors are what instigate the positive adaptations, both physically, mentally, on our nervous system. And so stress is a really important part of life that I think tends to become a little bit demonized. And so when I was looking at creating this resilience retreat, what I was really looking at is this kind of where my two worlds collide. One is my background in sports medicine and resilience training with athletes, which is a really interesting and always evolving topic of how do we push ourselves to be able to do as much as we possibly can to compete on the highest levels. And working with professional athletes has informed and a lot of my understanding of that. And I think it made it really an interesting world to live in, which I enjoy working with. But the other side is the burnout spectrum, which is really popular, becoming a popular topic, and rightfully so. And I think for a good reason, people are becoming more aware of this kind of burnout spectrum and needing to hopefully take care of ourselves before we go down that burnout pathway. And so kind of looking at both ends of this, both working with and treating burnout, as well as training the higher end of resilience, because both of these are, in my opinion, on the same kind of spectrum of resilience. And though they might require a slightly different dosage, probably more than anything, the approaches are actually very similar in my experience. So I just wanted to be able to bring this to people so that, it's not just the professional athletes that get access to this, but even the average human who wants to feel their best and perform their best, whether that's at work or in sports or in yoga or just in life with their families. We all want to be able to feel our best and be able to adapt to those stressors that we come in contact with along the way, which are really made to challenge our system and help us rise to the occasion and really get the most out of it, rather than letting the stress take us down, finding ways to optimize our responses to that. And I think yoga is such a really efficient and potent adjunct for that. It's the best, it's the best tool that I found, and a lot of great practices that we can use in that. So
it's, I think it's a really important point what you're making with this, like stress not automatically being bad. Like in the modern world, we hear the word stress and the automatic connotation is almost like, I don't want that. But stress is obviously, we wouldn't be here without our ability to experience that stress response. And again, a lot of good can come from that kind of stress response. But yeah, I guess the importance of knowing how to manage it. And I guess to touch back upon one of the things we mentioned a few moments ago is this idea of like body awareness. And I was reading a study myself recently which said that apparently people who suffer from panic attacks, you can detect the signs of a panic attack up to 2 hours before the actual event occurs. So the more attentive, I guess, you can become to your felt physical experience, the better chance you have of realizing when maybe you're going a little bit too, or working yourself a bit too hard, or whatever's going on is starting to become that little bit overwhelming, and being able to, I'm not going to say be able to fix it completely, but to be able to manage these things much earlier than if you didn't have that same awareness that yoga can give us.
right. Yeah, I think that's a really big part of it. And honestly, I think if nothing else, even if you were just to take one thing away from this podcast, just really starting to change how you see stress is such a big part of it. And I think so many of these keys to resilience are simple concepts that are just a little bit harder to really take with us and apply in our lives. And, it's easy to wrap our heads around, oh, okay, stress is positive and it brings positive adaptations. And, being aware of this kind of internal environment can help me understand where I'm at potentially before things become in some kind of disarray. I think it's easy to wrap your head around that, but then going and taking it into the practice, into our lives, can be a bit of a leap sometimes. It's one of those things that's easy to kind of say, yes, I agree, but maybe it's a little harder to actually use in our lives. But I think of, stress is really like a friend. It warns us of danger, but it also pushes us to be our best. And so really thinking about stress as a friend, I think, is an important way of reorienting and making potentially a really big shift in a really short, simple way, I guess, a short period of time. But then again, coming back to it is the key, and remembering that, that stress is a friend. It's a friend. It's helping you, but it's also warning you and telling you, hey, like you said with the anxiety analogy, is, I have to listen. I have to pay attention.
I don't think I've ever heard stress described as a friend before, but it's a really, really lovely idea. I wanted to maybe pick your brain a little while I have you, because for someone who has been around the yoga industry, I don't know why I have like a bit of an aversion to that word, but I probably shouldn't. But anyways, the yoga industry for as long as you have, I guess two things I'd be interested in hearing your thoughts on. One is, how do you see, in the changing, evolving world that we live in, how do you see the future of the yoga industry as a practice, as a profession? Do you see any big changes along the way, or what would your thoughts be as you kind of look forward at the next 5-10 years or even more of yoga as an industry, and how do you see it going?
That's a great question. I mean, I think my perspective is obviously very therapeutically oriented, and I think yoga has changed quite a bit over the last 28 years that I've practiced. And I think everyone, especially people who've been in the industry as long as I have, can be a little bit critical of it. But I personally am really excited to see the way that yoga's gone. I've always been the person of the mentality that, the more people come, the better. And wherever they end up starting is great, and if they stick around, they'll find the style and the teacher that's relevant for them. I really believe there's something for everyone and there's a benefit to every style. And at yoga medicine, we're not really a style as much as really training our teachers how to understand the body through these different lenses, Western medicine and Eastern modalities as well, to be able to apply it to the individual so that, all of these styles can have a place. And I think that's really important. From a therapeutic standpoint, I really believe that the future of yoga is going to keep expanding. I mean, if you had told me back in the 90s that meditation would be popular, I never would have believed you. And pranayama too. Meditation and pranayama have taken off quite a bit, and obviously the yoga practice too, especially in the world of social media. And so I'm really happy to see that. And I think, again, people that hang around hopefully start to realize that yoga has many faces, many uses. And as we go through the phases of our life, I think what's most important is to recognize that the practice can evolve and change with us, that it's not like a giving in to being older, that it really is finding a practice that supports us where we're at. I find a lot of yogis tend to kind of resist that and want to keep doing really aggressive, intensive practices, in their, 50s and 60s or whatever that might be, 40s, 80s. And I think it's important to embrace it as a way to support us in our lives. And sometimes that might be not necessarily just age related, but like for myself, I just started playing competitive tennis again, and I love that. And so my yoga practice is changing, but it's still there for me. It still is performing a very important function in my life that couldn't be replaced, but is different, than when I wasn't playing tennis all the time. So it should be able to evolve with us. And I think the therapeutic element of yoga will also be expanding, and hopefully we'll start to see some better quality research. And that one's a hard one just because there's not a lot of funding for yoga out there, and it really takes a lot of money to fund high quality studies. And there's other challenges to that as well. But I think, we see more and more doctors. We've got probably a quarter of our teachers are healthcare professionals of some sort, from surgeons to anesthesiologists to nurses to nutritionists, whatever that might be, naturopathic doctors, physical therapists, the whole gamut, acupuncturists. But I think, and we see a lot more people coming through our site, either through us or through our teachers, to have teachers help out in research or be hired on in hospitals or other medical clinics or physical therapy clinics. So I think that's just going to continue to expand. I don't think there's any way around that. I think that yoga's influence has staked its claim and made it very clear that it can have such an important and potent effect on our lives. And I don't think that's going anywhere, but continuing to expand. So I think in 5 to 10 years, we'll probably just see more of it, hopefully integrated into the healthcare systems, and just more clarity. I think that yoga is for everyone, that there is something for everyone. If you're in your 20s and you want to do handstands, or in your 40s and want to do handstands, whatever that is, if you want to have a practice to help with your lower back pain or to help with your anxiety or to balance your busy lifestyle, whatever that might be, there's something for everyone. And I hope that we'll just kind of get more clear on each of us, what we provide, and helping to get people in the right place so that they can get what they need from it.
And I guess my follow-up to that question, the second point of the question is for newer teachers. So I think with the ever expanding potential of yoga, it's something that's very, I don't know, it's very exciting and yeah, who knows where it will end up going. But sometimes as newer teachers, I find something that can be confusing for a newer teacher is that there's no one thing that is yoga, and figuring out your place within the vastness of it can be almost overwhelming potentially at times. So would you have any advice for someone who's just starting out in their teacher journey, how to, any general advice, I guess, in terms of navigating the vastness of what yoga potentially could be?
Well, I want to say first, I think it's such a great question. Like, what is yoga? It's something I think about a lot. And my answer to that, I think, has changed a lot over the last 28 years. And, and we all see the world through our lens, through our perspective, of course. And I've had the pleasure of working with a teacher who's taught our course, Yoga and Politics. Firdos is an incredible teacher who's taught me a lot about the history of yoga and has had me contemplating, what is yoga. And I think it's an important thing to contemplate, especially as yoga modernizes. And I think sometimes that can have a negative, concept with it. But I think the modernization of yoga, again, is a testament to it withstanding the test of time and being relevant even in modern days. And, I think in order for us to meet the individual, we have to be able to modernize those practices. So one, I love that. I love that idea of like, what is yoga? And, to me, yoga is what is needed by the individual. And the beauty of yoga is that it really looks at all the different layers of the person. So, but my advice to new teachers, I would say my biggest advice to new teachers, I think, is to keep practicing, whatever that means, even if that's, whether that's asana, pranayama, meditation, myofascial release, whether that's 10 minutes or 2 hours a day, or 2 minutes, whatever that is. I think your own personal practice is the most important thing that you can teach from as a teacher. And such an important way to stay inspired and rejuvenated. I mean, we tell our own teachers, our students that as well. So it's such an important thing to maintain. And I know for a lot of people who kind of jump in, some people will jump into teaching full time. It's really challenging if you're teaching full time to maintain a personal practice as well, because, you're doing physical asanas potentially all day. And, you come home and again, like my tennis, maybe what you need is more restorative or meditation or something else. So allow your practice to evolve, and keep learning. I think like anything, whether you're a medical provider or a medical specialist, even if you're, I had a client, a student who was a heart surgeon who only put in stents. He had very specific specialty, even within a specialty, we have to continue to keep learning. And as a yoga teacher, you might have a specialization. Most of us have some sort of specialization, meaning we're either teaching more dynamic asana classes or maybe more restorative classes or maybe a different certain demographic. But I think it is helpful to specialize if you have a specific niche that you're interested in. But whatever that is, to just continue to keep learning and know that there's no end point. I think a lot of our teachers who go through our programs, even at the 1,000-hour level, so we have our therapeutic specialists at the 500-hour, and even when they get to the 1,000-hour, there's this feeling of, I think the more you learn, the more you realize you don't know. And so I have to make peace with that balance of continuing to learn and invest in that learning, free or paid, not necessarily financially investing, but investing my time. But then also knowing how much I have to offer. So even as a brand new teacher, you have so much to offer your students. You just have to get out there and start doing it, and using it and putting it to use is a big part of the learning as well. And so, you can learn from books, from podcasts, from teacher trainings, whatever that might be. And also by teaching is one, and by practicing is also another way of learning. And so knowing that it's always going to be a learning process. I'm still learning and evolving my own teaching. And so, I don't think that will ever end. And that's the beauty of studying any topic that has such a deep pool of knowledge to it. And, when you're working with students, I would say the other thing I would mention is just do no harm, start simple. I think as teachers, we learn a lot and we want to be fancy and we want to have cool things to offer. But the first step is, do no harm, especially when we're talking about therapeutics. And so the simple things can often be the most potent, like instilling body awareness in people. We know too that just as far as pain goes, we know that proprioception, our awareness of our body in space, this kind of sensory awareness, competes with nociception, which is what eventually is turned into pain in the brain. And they compete in the spinal cord. So I'll just simplify that and say, if we have less body awareness, our body puts out a magnifying glass for pain, for these changes in the system, these disturbances in the system. So nociceptors are just really looking for any extreme changes in chemical temperatures, pressure, to warn the body of a threat. They're threat detectors. So our body puts out a magnifying glass for those if we don't have enough sensory input to the system. So just increasing our body awareness can be so helpful. So it doesn't have to be fancy, but do no harm, start simple, keep practicing, do no harm, keep practicing, keep learning. Those are my top three. And if you stick to those, I think you'll have a long, sustainable, and fulfilling career, because ultimately as yoga teachers, our whole life is about helping others. It's about doing the best we can to help the people around us and to offer our services as a tool for our communities.
It's a very inspiring answer. Thank you. I never knew that about proprioception and neuroception almost, or nocioception, sorry, almost competing to a certain extent. But it's something that I've personally, with everything that I've gained from practicing yoga for the amount of time that I have, it's the awareness that is the foundation. Like the expanded awareness of body, breathing, mind, whatever, that is the key. If something needs to be changed, the first step is you need to become aware of it, and so much follows on from that. I think it's my final question, which is going to be like a big question. So I don't want you to feel under any pressure to answer this in any huge detail. But you mentioned the yoga and politics course, which sounds incredibly interesting. And I guess if you wouldn't mind giving us a small overview of it, and tied in with this is, do you believe that yoga has the potential to be a tool not just for personal change, but for wider societal change as well?
Yeah, I mean, I think the easy answer to that is yes. This is definitely out of my comfort zone. I'm not a specialist in this. Firdaus, has her whole academic experience within this realm, so she brings a wealth of knowledge to it. I'm really grateful to have her. But our course on the yoga and politics, we also have one coming up on decolonizing yoga, really just looks at the systems of separation. I think she, for me, takes a really interesting peek into the history of yoga to look at really what's behind it. Like, who are the gatekeepers of the knowledge, and how has it been passed down, and how has it evolved? And what are the systems we want to support? And is it a religious practice? Are there things that we should dig a little deeper into and unpack? Is it, a practice of liberation? Are we doing practices that are perpetuating systems that aren't about liberation, but rather about restraint and keeping people in place? Like for instance, this idea of Dharma. We kind of talk about Dharma as, our purpose and our destiny, which is cool. I think it's great to talk about that, but really, back in the old school times, it was really about keeping the caste system in place and allowing the lower caste to encouraging the lower caste systems to give over the fruits of their labor because it was their dharma. And that, I mean, like, that's such a one in a million things, but that she's opened my mind to. And it's been really interesting to look at the different systems and how the different religions have influenced yoga, that it's not one religion, that it actually is many religions who have influenced and participated in yoga. And what's happened as under colonization, as it came over, and then as it came over to the West, the systems that have changed it and influenced it. And really that, it's not a thing of its own, but it really is something that has evolved and been influenced by so many different cultures and religions and parts of the world. Obviously, the West has had a huge influence on it, and the US has had a huge influence on it, and we can look at, positives and negatives of that, of course. But looking at, of course, cultural appropriation and, the important topics to keep in mind there, I think is a really interesting conversation, and decolonization of the practice, and just looking at yoga outside of the studio, and political future, and things that maybe we didn't realize were politicized. So that's a short introduction, but I think there's so much to it as a yoga teacher that's important to keep in mind. When we're teaching these classes, you really could have a whole degree in this stuff and still not know it all. So I think that's important, to stay open to the mystery and continuing to learn there as well. But yeah, I'm more of a person who's always been focused on the doing, the practices, the present moment. And maybe it's my older years now, starting to appreciate history a little bit more. But I think it's been a really interesting study with her to learn more about, not just about the history, because I've always been familiar with the history of yoga, but the nuances of the history of yoga and the applications to our present day practice too. So
yeah, I'm generally interested in history, but also the history of yoga is something that I find fascinating. And for me, it's I don't know, learning a little bit more about the history, in my experience at least, it's actually makes you appreciate how there's never been one thing that is yoga, and it's always been contextual and of its time and its place. And I'm not even close to being enough an expert to really talk with any huge amount of authority on these things, but for me it gives us a little bit of freedom to adapt, that we don't feel too, I guess, I don't know, that just because things are historically done a certain way doesn't mean that they're going to continue to be done this way or have to be continued to be done this way, and that for yoga to be useful, it needs to be adapted to its context. But yeah, definitely a bigger conversation to be had, probably by people maybe a little bit more qualified than us to have it. But I do appreciate the answer that you gave, and
yes, it's definitely out of my range of expertise.
But the course sounds great. The course sounds really good. I'm gonna keep an eye out for that for sure. And so, conscious of the time, I don't want to keep you too long. So just to say thank you again for taking the time out of your day to have this chat. I know you're very busy. And also just to say thank you for all of the great work that you have done and continue to do in helping yoga, I don't want to say move forward. I'm not sure if that's the right way to put it, but everything you've contributed to the development of the things that we practice, because you're definitely a very influential figure, I think, in how yoga is practiced today. So yeah, thank you for your time. Thank you for your work. And as I said, we're very, very excited to have you with us soon.
Thank you. That's very nice of you to say. I appreciate it. And the only thing I will just mention before we leave that we didn't really talk about is the fascia, which is kind of my other love. But I do think that is the one area that we have a lot of research and is a really interesting area to look at and compare and use within the yoga world, whether that's MFR or in our asana practices. So I always love those intersections of being able to take things that are starting to make sense to us in a Western concept and bring them into a yoga practice, bringing the new research in. And so that's always a fascinating area to me as well. I really appreciate the conversations and great chat. Thank you for having me.